hey guys, Dr. Anderson here, and I'm here with Peri. She came to us with some symptoms on her right leg that really seem to be like neuropathy symptoms. But kind of unbeknownst to her, she has that going on. And also had some weakness in her left foot. Very subtle, but couldn't pull some of the toes up towards her and to the side. And then also had some sciatic pain, right?
Right.
And what I do here is we do a nerve block. It's a test, and it's called Phoenix sign. And what we've done just a few minutes ago, maybe 10, 20 minutes ago, is we used this ultrasound machine over here, and we were able to localize the nerve, which is about right there. And we put just a little bit of local anesthetic underneath the skin, but right above a nerve branch here called the common peroneal nerve. This common peroneal nerve is a branch of the sciatic nerve, and it supplies everything on the top of the foot, and it also supplies some very important muscles that pull the foot up, pull the toes up, and also pushes the foot sideways. So can you explain? I'm just going to have you, maybe say how little. You had quite a bit of weakness in the big toe before.
A lot of weakness.
A lot of weakness.
I felt I couldn't lift at all.
Like she could barely lift it up. So now demonstrate how much you can lift it. And look I'm fighting this. So we don't have a before video, but she could barely lift it up against resistance. And I gave her on a scale of 1 to 5, about a 3, but now she's a 5 in terms of strength. And these toes also were kind of weak pulling up, but now she's able to do that. So when I do this injection, it simulates what that nerve is doing. In other words, we do surgeries on the common peroneal nerve quite frequently to help with drop foot. So this gives her some reassurance, the patient, that if she ever elected to have surgery there, it should help with her drop foot. She's also having improvement of sensation there. What was the sensation like there before the injection?
Even for the touch, light touch would trigger it, the pain.
It would trigger pain?
Yeah, sensitivity.
So would it be fair to say it was very hypersensitive?
Yes.
Like, get away from me, don't touch me?
Yeah, exactly. Sometimes even clothing, rub it in and you will feel.
Yeah, very sensitive. Yeah. Okay, and not so on the other side?
No, not at all.
No, okay. And now talk to us about the sciatic pain.
The sciatic.
That's much better?
Yeah, that's good too. I couldn't really lay down.
And I want you to just lay down and demonstrate, like,
yeah, okay.
I don't, just right now,
This used to be a worst position for me.
Worst position for sciatic pain.
Pull the whole,
And now do it. Now,
I don't feel anything right now.
But if you lift your leg up, do that.
I can do that too.
Like normally you would not have been able to do that, correct?
No, it would be pulling right away.
And that's a real common test that we would do to test sciatic nerve, because that usually elicits quite a bit of pain when you have sciatic pain symptoms. So my point is, this nerve tunnel, and it's compressed, can help if it were to be open with sciatic pain. And that's what we want you to understand. So it's kind of like 4 things. Number 1, helping with strength. Number 2, helping with sensation here. I'm missing one. Maybe there's only 3. But also with the sciatic pain. And that's something I think you all need to understand. It's really important to understand that the common peroneal nerve is a problematic area, and it's maybe my favorite nerve because it has so many things that it does, and it can help people with. A lot of people aren't aware of this. You weren't aware of this when you came in, were you?
No, I was not.
Yeah. And how long has this? And
I
came in for. And how long has this been going on for you? Just tell a little bit of your story, real quick.
Really seriously, on this issue with the leg and the strength, it's the past 2 years.
2 years.
But I
okay.
have going back like maybe 7
years
when I first started to note things.
But you came in originally in the very beginning. You said something about, I feel unstable, or not, kind of weak.
Exactly. It was gradual,
Right.
I felt like my ankle wasn't supporting me as good,
right.
And I felt this little clumsiness at times and stuff like that.
Very good. Well, we appreciate you, because this is new stuff for a lot of people watching, and so whenever you volunteer, we really appreciate you doing that, and you're doing a good job, by the way. So, those of you that are new to Anderson Podiatry YouTube channel, please consider subscribing. We've got a lot of good content in here. And I guess that's it for now. Don't forget, common peroneal nerve can be implicated with your sciatic pain and also neuropathy type symptoms that people are getting primarily on the front of the leg and down into the foot. So thank you for volunteering.
You're welcome.